This year, we'll spend an estimated $80 billion, meanwhile, on cancer drugs worldwide, a number expected to only climb. There are currently nearly 900 drugs in development for cancer treatment and thousands of studies being conducted. This all coming as the world's biggest cancer research meeting kicks off in just a few weeks. That is ASCO, the annual American Society of Clinical Oncology meeting, or ASCO, is widely watched by Wall Street, usually triggers moves in a number of related companies. So what might we expect this year? Joining me now is Dr. Ronald DePino. He is president of MD Anderson's Cancer Center, one of the most well-respected centers exclusively for cancer patient care and research. Dr. DePino, it is great to have you on the program.
Good to be here.
Good to see you again. When you see something like Facebook, it's got to remind you, deja vu, a bit of some of the biotech situations that you've seen. You're an entrepreneur yourself.
Right. Well, we are at a very special transition in the history of the biotech sector in general and cancer drug development. The costs that you quoted are ones that are driven largely by the fact that we didn't have all of the technology needed to be able to illuminate a path towards identifying key targets, generating drugs against those targets, and knowing what fight to pick in the clinic, actually which patients should get those drugs. That has changed. It has changed very quickly. So we now have much of the technological capability to really understand cancer on a very fundamental level, to be able to develop drugs more efficiently and more effectively.
Well, this is part of the reason that we even started this segment, Money in Medicine, because I've been astounded at the money moving into healthcare and the activity around cancer-related issues, and the fact that technology has really enabled so much more. You said to me once, we have a moonshot opportunity right now to cure cancer, is what you said to me.
This is an historic moment in the history of science. Never before has there been such a powerful confluence of technological capabilities that are game-changing. The ability to sequence in hours for a few $1,000s what took billions of dollars in a decade only 10 years ago. The computational firepower that we have. The nanotechnology advances in material sciences, in imaging. The ability to manipulate genes at will. All of these things that happen at one moment, and essentially it's given us the complete toolbox to understand cancer on a fundamental level and do something about it.
Are there companies out there, I mean, from an investment standpoint, for our audience is obviously looking for money-making opportunities, trying to figure out how to capitalize on what's going on in this marriage of healthcare, technology, and biotech. Are there companies out there that you think are most promising? And also, what is going to come out of this ASCO meeting, you think?
Well, the companies, in the biotech sector, you have to be very careful because you have to really understand which companies are driven by good management, that are driven by the kinds of scientific advances that I've mentioned. And there are a few of them out there. Historically, of course, Genentech was one of the prime examples of this. More recently, a company...
They were the first to come out with that targeted
targeted. So
treatment.
You think about Herceptin and so on. Those are very important advances. And in fact, some of the most effective drugs have come out of the idea of using science to shepherd cancer drug development. A company that I was involved in founding, Aveo Pharmaceuticals, one of the more successful biotechs.
That's AVEO, is a symbol.
That's correct. Has exploited science-driven drug discovery, and it's about to announce, or has announced already publicly, and it will present in detail at ASCO, a very effective drug that has a superior safety profile for renal cell cancer, a major unmet need. So these are massive advances in our ability to really do something about a disease that has long been very refractory.
And are you seeing the kind of money required moving into this area? Are you seeing investments increase around this? I mean, healthcare as a group has been one of the more active groups.
Yes, in general. In the biotech area, I would say it's been up and down. And in terms of starter-ups, the young companies, the privately held companies, since about 2007, it's been under significant stress. So the companies that are being generated today are ones that are rather anemic and are not well positioned to harness the full power of what we're capable of doing. And this brings up a very important point. If you look at the drug development ecosystem, where you have academia doing discovery and then biotech bringing it to proof of concept and large pharma taking it across the commercialization goal line, that ecosystem historically has a 95% failure rate in cancer drug development. This is one of the reasons why drugs are so expensive.
Right.
So at MD Anderson, given that we're the #1 cancer center, we have a critical mass of talent and capability, we can do things that can bring that ball down the field so that the launch points are more effective in going into the private sector. And that will change, I think, the rate of failure rather dramatically.
All right, this is just an extraordinary story from a money standpoint, but mostly from a science standpoint and the hope around cancer. Doctor, good to have you on the program. Thank you so much.
Thank you very much,
We so
Maria.
appreciate it. Dr. Ronald DePino joining us, President, University of Texas, MD Anderson Cancer Center.